Welcome to Dr. Jose and Rodriguez Memorial Hospital and Sanitarium. I am Dr. Mariel Abanyo, Department Chair.
And I am Dr. Rosel Martin, Training Officer, and we will walk you through our facilities.
Welcome, accreditors!
The hospital was established in 1940 and was formerly known as Central Luzon Sanitarium. It is located in Tala, Caloocan City and occupies 130 hectares of land area. Last January 1, 2019, the hospital was accredited as a Level 3 General Hospital with a tertiary level clinical laboratory and pharmacy. Before the pandemic, upon arrival at the emergency room, patients are triaged to specific department depending on the patient's chief complaint. Patients are wheeled into the OBGYN emergency room, which is located separately from the main ER. Upon arrival at the OBGYN emergency room, patients will be interviewed and assessed by a junior OB resident on duty assigned at the ER. Vital signs, fundic height, and fetal heart tones will be taken. Adjacent to the emergency room, on the right, is the LRDR MHRU complex. The labor room has 4 beds, and across the hall is the maternal high-risk unit with 5 beds. These rooms are equipped with handheld Doppler, CTG machine, BP apparatus, oxygen tank, and emergency cart. Patients are hooked to the CTG machine and monitored by duty residents. Across the MHRU is the delivery room with 2 lithotomy beds, handheld Doppler, CTG machine, 3 bassinet, and a resuscitation area for the newborns. Across this room is the PACU with 4 stretcher beds, BP apparatus, a cardiac monitor, and an emergency cart. Located at the end of the hallway of our LRDR MHRU complex are 2 OR theaters for our OBGYN procedures. Each theater has 1 operating table, anesthesia, and suction machine. At the far end of the LRDR MHRU complex is the NICU, which has 6 incubators, 15 cribs, 3 phototherapy, and a cardiac monitor. We have the OBGYN ward, the main ward located on the first floor just across the LRDR complex, and an extension ward located at the second floor with a total of 68 bed capacity. Our ward is also equipped with its own emergency cart and has an isolation room with 1 bed capacity. We also have our outpatient department clinic where we do daily consultations from Monday to Friday. The old OPD building was located near the Gate 3 entrance. Renovation was started in 2018, hence the OBGYN clinic together with the other departments was relocated at the second floor of Building D. Our family planning unit is manned by our trained and skilled staff. The unit have trainer of trainers for BTL, IUD, and FPCBT. Our goal is to be one of the DOH accredited training facility for family planning. Before pandemic, we have a separate teen parents clinic or TPC. Teenage mothers are given counseling about motherhood and family planning. Relatives of TPC patients are encouraged to be with them during consult. Patients who are advised for imaging are referred to our ultrasound section, which is located at the main OB ward. We cater to both inpatient and outpatient every Mondays and Fridays. We also do emergency scan if necessary. We have our colposcopy cryotherapy room located near our OBGYN emergency room. Patients for colposcopy are referred to gyne-onco service. We also have the radiology department located at the first floor of Building D. Since the start of pandemic last March 2020, our hospital faced transition to accommodate the needs of our people. The outpatient and emergency medicine department temporarily ceased its operation due to the pandemic. The hospital was converted to an end referral COVID hospital together with PGH and lung center, catering to moderate to critical COVID-19 cases in northern Metro Manila and nearby provinces from south to north. We became a COVID-19 only facility. Last November 2020, our hospital started online and teleconsultation. In December 2020, we gradually opened our face-to-face OPD consultation. Patients' appointment for the face-to-face consultation are given via teleconsult. With the declining number of cases of COVID-19 in the country, our emergency medicine department opened its doors again to non-COVID and COVID suspect patients last January 2021. Transitions in the facility and new protocols were made. However, in March 2021, there was a surge of new COVID-19 cases Hence, the OPD and EMD was again temporarily closed to accommodate more COVID-19 referrals. Currently, the hospital remains to be a COVID-19 referral hospital. Patients are referred via one hospital command to the medical center chief through the Hospital Epidemiology Surveillance Unit or HESU, and once approved, necessary lab results and documents are then forwarded to different departments for the MD to MD endorsement. Once the patient arrives at the receiving tent, the duty team will be informed. An admitting slip will be given to the relative to facilitate admission at the admitting unit located in front of the receiving tent. Parturients are transferred to the COVID LR. Upon entry at the COVID DR complex is the nursing station and a supply room. A designated donning and doffing areas are located within the complex. To ensure safety of our personnel, proper donning of Level 3 PPE is warranted. A donning personnel will check the completeness and appropriateness of Level 3 PPE being worn. Situated at the right end of the LRDR OR complex is the COVID OR, which is shared with the other cutting departments. This is where we do our procedures for confirmed COVID-19 patients. This room has an operating table, an emergency cart, an anesthesia and suction machine. This is a negative pressure room which also has high efficiency particulate air or HEPA filter. After every procedure, the biomed team uses a robotic UV light to disinfect and sterilize the area. Adjacent to the operating room is the COVID LR MHRU. Each room has 4 beds with 1 CTG machine, handheld Doppler, BP apparatus, and an emergency cart. Receiving vital signs, fundic height, and FHT are taken once patients arrives. She is also hooked to CTG machine, and baseline chest X-ray with abdominal shield is done using portable chest X-ray. Swabbing is done by a trained laboratory personnel. Our molecular laboratory was accredited in July 2020. It has 4 gene expert machines, 1 fully automated extractor, 2 semi-automated extractor, and 4 RT-PCR thermocycler. The laboratory follows the dictum all in, all out, meaning all specimens brought in are brought out at the same time. This dictum facilitates strict adherence to the protocol to avoid contamination. Once the mother is in the second stage of labor, she will be transferred to the delivery room, which is located across the COVID OR. After delivery, newborn is immediately handed to Pedia and brought to NICU. The NICU is located at the far end of the COVID LRDR HRU complex. Newborns are swabbed under 24 hours of life. Postpartum mothers are transferred to COVID ward after observation. 15 bed capacity are allotted for OBGYN COVID patients. Each room is provided with their own BP apparatus, pulse oximeter, and thermometer. In each room is a CCTV camera. TV monitors are placed in the nurse station on all floors. For severe to critical cases, they are co-managed with the IM department and placed at the MICU. After transfer, the resident goes to the designated doffing area. Patients' rounds are done twice a day by the duty team. Relatives are also updated through phone calls. Once with negative RT-PCR swab and recovered, patients for discharge are given health teachings regarding hygiene, breastfeeding, family planning, and OPD follow-up. In order to cope to the needs of the community and because of the decreasing cases of COVID-19, last April, our department started to accept gynae teleconsultations. And eventually, on May 17, 2021, our OPD once again opened for face-to-face consult. Currently, we are conducting our outpatient consultation at the newly renovated OPD building. Patients seeking consultation are screened at the triage area located at the entrance of the OPD. A triage doctor initially assesses the patient based on their vital signs and presence of signs and symptoms pertaining to COVID-19. Once cleared at the triage, an OPD chart is printed and sent to the respective departments. A triage staff will usher the patients to the OBGYN clinic. If the patient is not cleared, they will stay at the holding area. Patients who are for elective surgery are swabbed on the day of admission and stays at the holding area while waiting result. Inside the OBGYN clinic, minimum health standard protocols are observed. Doctors, staff, and interns wear level 2 PPE. There is also an acrylic barrier in each consultation table. Inside the OPD clinic are 5 consultation tables, an examination room with 2 lithotomy tables. Subspecialty clinics, the REI, Gyne-Onco, and Maternal and Fetal Medicine have their schedule at our OPD. Resident rotators assess and refer patients to subspecialty consultants. A logbook for referrals is provided for each subspecialty. Adjacent to the OBGYN clinic is the family planning unit where trained doctors and midwives do counseling and procedures such as PSI and IUD insertion and removal. Located at the entrance of our OPD is the Malasakit Center, which provides financial assistance to our patients for their laboratories and medications. Our ultrasound section continue to provide services for both inpatient and outpatient. Also at the same room is our colposcopy and cryotherapy area. Located at the left side of the hospital main lobby is the non-COVID LR MHRU. Upon entrance to the complex, on its right is the labor room with 3 beds. Our MHRU is located on the opposite end of the labor room, which has 3 beds. Each room has its own handheld Doppler, BP apparatus, CTG machine, and emergency cart. Situated at the second floor of Building C is our non-COVID ward. We have 3 obstetric, 2 gyne, an isolation room, and 2 transition wards with a total of 35 bed capacity. Level 2 PPE are available at the nursing station. Previously, the main OR situated at the back of the emergency medicine building became the non-COVID OR, which has 2 OR theaters shared by all cutting departments. Furthermore, the first theater on the right is the designated non-COVID delivery room with a lithotomy bed and its own emergency cart and oxygen tank. Each OR theater contains its own anesthesia and suction machine. We also have the Storks laparoscopy tower for our minimally invasive surgery. Specimens are assessed by the patho-rotator with the supervision of board-certified pathologists. The services offered by the pathology department are frozen section, cytology, histopath, bacteriology, microbiology, and drug testing. Across the laboratory is the blood bank, where blood donations, processing, and procurement of blood products takes place. Situated at the ground floor of Building D is the radiology department. Services offered are MRI, CT scan, ultrasound, mammography, and X-ray. Amidst this pandemic, we have adjusted to changes. In our department, learning is continuous. Daily admission conferences, weekly audits, pre-operative audits, surgical path case conferences, clinico-sonopathology case conferences, webinars, lectures, actual demonstrations, practicals, and written examinations, annual research paper, and interesting case presentations are conducted through utilization of different platforms to hone our residents' confidence and knowledge. Furthermore, different learning materials such as textbooks, clinical practice guidelines, and medical journals are available in our department's library for the usage of our residents for their researches, reports, and presentation. We also have an up-to-date subscription where we search for recent journals. Our residents have their own quarters where they can study and keep their belongings during duty. By August 2021, the Emergency Medicine Department will open to general cases. We have designated a clean area for emergency non-COVID cases and an ER transition tent for patients awaiting swab results. However, our battle with COVID-19 still continues. The pandemic shadows will still loom over us. We are committed to provide quality healthcare for women that is accessible, readily available, and affordable to the community, producing competent and efficient healthcare providers with an accredited training program to sustain a strong partnership with the stakeholders. Transitions are to come, we'll adapt. I am Dr. Maylene Atienza, Chief Residence.